Bengaluru has had its first case of COVID reinfection at the Fortis Hospital on Bannerghatta Road in the city. A 27-year-old woman has been found to be the first confirmed victim of COVID-19 reinfection in Bangalore. She has no history of comorbidities and had tested COVID positive in July after she developed mild symptoms of fever and cough. She'd recovered well and was discharged successfully after being tested negative for COVID. However, in a span of just 1 month, she's developed mild symptoms and has been confirmed to have been transmitted COVID infection once again. Well, joining us now, Dr. Pratik Patil. Thank you very much, sir, for being with us. Dr. Patil, how is this even possible?
Hello, good evening. So the case which we are talking about, she was having influenza-like illness, so what we call in medical words. So she had fever and cough in the month of July, first week. And she had a mild infection. She recovered without any complications. And she was tested negative subsequently. She was all right for a month. And then she again had a fever, cough, body ache, these symptoms again. And on retesting, she has been tested positive. Now, the interesting fact in this is that the IgG antibodies, which usually represent immune response following an were negative in case. So probably she did not develop the immunity following the first infection, or if she had developed IgG antibodies following that infection, the antibodies disappeared within a month's time.
Right.
So that's what left her susceptible to the reinfection.
Dr. Patil, does this have some sort of a bearing when it comes to a vaccine as well? The real concern that given that we know so little, we don't know how long a vaccine, when it actually comes, will be effective, because antibody reactions, the formation of antibodies seems to differ from patient to patient.
That's right. I think that holds true for all the vaccines. Not everybody who takes vaccine will develop immune response following the vaccine. So that we need to see again in the COVID vaccine as well. So like in case of influenza, so it gives protection to around 60% of the cases following the infection. Around 30-40% of the people do not develop antibodies. So we need to know about COVID also. So once we vaccinate on a larger scale or in the phase 3 trials, so we will know what is the efficacy of the vaccine and how many percentage of the people that develop vaccine after the first dose or second dose if it's required.
So Dr. Patil, is it possible that there are individuals who don't develop antibodies to COVID at all despite getting the infection?
It may be possible. So there is not much literature about this, but there was a study in JJ Hospital which was recently published. I mean, I'm not sure whether it was published, but it was a news again, saying that they had studied the persistence of IgG antibodies in healthcare workers, and the average duration was around 50 days. So in 50 days, the IgG antibodies disappeared.
All right.
So it can vary according to the individuals and individual immunity. So
All
some
right.
of them may not develop antibodies.
Yeah.
That's a fact that we know, that not everybody can mount an immune response. And this particular patient that we had, she is otherwise a healthy woman. She doesn't have any other immunocompromising condition which would make her not to develop antibodies.
Is this second infection, or is, since, you know, I mean, it's a confidentiality issue, the broader issue is if there are patients who pick it up once again, is there a strong possibility that the second round of infections will be weaker than the first one?
I don't think so that we have information about this. The particular patient had mild infection again, and she has recovered through that as well. So we don't know, like in some infections, we see that the second infection is milder, or in some infections, we see that the second infection is severe. Like in dengue infection, if you had been exposed to dengue virus in the past, the second infection is supposed to be more severe.
Right.
So we don't know about COVID because there are only few cases of reinfection so far. So we really don't have much of information about it.